Welcome to another Founder Wisdom Pod. We have Dr. Christoph Guger with us. He is the founder and CEO of GTech Medical Engineering. He is in Austria and has been into BCI and Neurotech for pretty much his whole life. So today we're going to talk about that. One of my favorite topic. You're going to see a real-time painting that was painting with an artist's brain behind him. It's quite impressive. This podcast is brought to you by podpire.com. That's my podcasting company if you want to start or scale a podcast. It's also brought to you by this new topic here called Qualia Mind. If you want to optimize your brain as an entrepreneur, if you want to get some energy, get some focus, help with your memory as well during a busy working days. I work at least 16 hours per day since God knows when. It really helps. So, Christoph, welcome to the pods. Tell me a bit more about yourself and what you're up to nowadays.
Thank you very much for the invitation. So my name is Christoph Guger from GTech in Austria. We are designing brain-computer interface technology and neurotechnology now longer than 25 years. So we started when only about a few labs worldwide were working on brain-computer interface technology, and then we started to equip universities and research centers with the technologies. And a couple of years ago, we started also with medical products. And just a few years ago, we started also with consumer electronic products so that people can just use brain-computer interfaces at home.
Why BCI? If you go back in time, when did your fascination started?
This was actually when I studied at Johns Hopkins University. They told me about a professor from Austria, Gerd Purcell, and he worked on brain-computer interface technology. Of course, I didn't know him because it's always difficult to know the professors and whatever is cool in your home. And so they invited me to Gerd Purcell, and then when I returned from the US to Austria for my master thesis and also PhD studies, then I landed in his lab and started with brain-computer interface developments during my master thesis, actually.
And just like by serendipity, did you ever had deep fascination with the brain as like most smart humans do? And where do you think BCI technology could lead us as a human race?
There are many different applications. So 25 years, we just moved the cursor left and right on the computer screen. And a couple of years later, we enabled locked-in people who were completely paralyzed to spell or to form words and sentences with the brain-computer interface. This was also the initial target of all the BCI researchers, to enable locked-in patients to move an avatar body or to communicate. Nowadays, there are many more other applications. We use it, for example, very often for stroke neurorehabilitation. So in this case, stroke patients have to train with the brain-computer interface 25 sessions long. They have to imagine left-hand movement, right-hand movement. The brain-computer interface is able to pick it up that the brain is doing it at the moment, and then we switch on an electrical stimulator which stimulates the muscles on the left hand, on the right hand, on the foot, so that the hand, for example, really moves as soon as the person imagines the hand movement. And this produces neuroplasticity, so it pairs cognitive processes again with motor behavior, and patients just get much better. And this even works 10, 20, or 30 years after people had a stroke. So normally doctors and neurologists tell patients after 1 year there's no progress anymore, but we always see progress in these stroke patients. And then we applied the same principle also for people with multiple sclerosis. It works also very nice. So these people get also much better. And normally everybody talks just about the decline if you are diagnosed with multiple sclerosis, and they give you medicine to slow down the decline. And our brain-computer interface, that's actually called Recoverix, is actually the first product which makes them better again. And for multiple sclerosis patients, it's the same like for stroke patients. It's very important to reduce spasticity. So very often they have very stiff legs, well, hands, they cannot move them. And with the therapy, we can significantly reduce spasticity, and then fine and gross motoric skills are coming back, so they can use hands and feet again, can walk faster, get better balance, can stand up and sit down more precisely and faster. But we have also very interesting side effects, and they're all good. For example, the fatigue is dramatically reduced. So we had, for example, a language therapist in Vienna, and she could treat one child before doing the therapy, and afterwards she had to sleep. And nowadays, after recovery, she can treat 6 children, and afterwards she goes shopping, just because it's possible again. It is also many, many years after the MS was diagnosed. And we had also people who were in the wheelchair, so they didn't walk anymore. And after the treatment, after 50 treatments and so on, they started to make a few steps. And after 100 treatments, they were able to walk from the parking slot that we have in our therapy center into the therapy room and back. So dramatic improvement that we see. And another system where we are working on is for coma patients, or patients who are a little bit better with disorders of consciousness. So they don't move, and nobody knows if they can follow conversations or if they understand you. And with the brain-computer interface technology, we can test this very quickly. Within 2.5 minutes, we know if they have command following, and afterwards they can answer yes and no questions. And we ask them normally like 10 questions where we know the answer. Is your first name Charles? And so on. And if they answer correctly with the brain-computer interface, 8, 9, or even 10 out of 10 questions, then we get a very objective proof that they are able to understand us. This is changing their life, because suddenly family members are coming back and they speak and entertain, the patients. Doctors are more motivated, and otherwise, they would just lie in the bed and nobody would take care. And the third medical product, which is very useful, is for epilepsy and tumor patients. It allows neurosurgeons with brain-computer interface technology to find the most important centers in the brain. This, for example, the finger region, which gets activated when you move your fingers, or the tongue region when you speak. And this is crucial information, because if the neurosurgeon cuts this cortex tissue out, then you cannot move your fingers anymore. And we need only a couple of minutes for finding these centers. And this is very nice for neurosurgery, because a large team is involved, and results are very important to get it as quick as possible. And in epilepsy units, they are normally doing electrical cortical stimulation of all the different brain regions to figure out where the most important centers are located. This takes 1 or 2 days. This is also a kind of nightmare for a patient, because you're basically sitting there with open head. So a scalp is removed, they stimulate your brain, and you have to be awake. So this is not funny at all. And they can also produce seizures, because they provide electrical stimulation of the brain. So they can get seizures, and then the mapping procedure has to be stopped, and they have to continue a couple of days later on. But this is pretty tragic for the neurosurgeon and also for the patient. And the last product that we have is our Unicorn Hybrid Black series. This is a much cheaper brain-computer interface compared to the research and medical devices. So it's between 350 and 1,000 US dollars. So it's pretty affordable. And with that, we can play, for example, computer games. So you can control, for example, a smash hammer from Fortnite with your brainwaves. So you can use the keyboard with your fingers. With the BCI control, you can activate the smash hammer so that it destroys everything in the environment. But that's a kind of development environment also that game developers can use to come up with new games. And this triggers, of course, very nice ideas.
Fascinating set of products you have. First question I had for you is like, why start your own company instead of working for someone else? You did that almost out of university.
Yeah, so my parents were self-employed. They were also running a business. So for me, it was always clear that I'm also running my own business. I just made the decision between brain-computer interface and neurotechnology and building wind power plants. So when I was younger, I built a couple of these plants, but then I figured out it's very you need, the okay of politicians to be allowed to build it somewhere in your garden or on the mountains. And this is something that I didn't like. So with BCI and neurotechnology, I could just develop with my own speed, and I was not depending on the opinion of anybody else. And that's the reason why I moved into this field independently. And running your own company is, of course, a lot of fun, because whatever you do is exactly what you want to do. And, even if it fails, it doesn't matter, because then you can do another project. And nobody complains, because it's your own decision where you want to go. And this is just the way I want to work. So I would never work for another company. So if I wouldn't build brain-computer interface, I would just run another company.
Right. Lots of fun, but lots of funding as well. I would guess in a company like yours, like, did you get any funding to create all of these products?
No, we are 100% privately owned. So we just had our first client 25 years ago. So we worked a couple of months to earn a few €100. Then it was reinvested. So the first investment was to purchase a MATLAB license, a commercial license, so that we were allowed to sell MATLAB code to researchers and universities. And then the first system actually went to university in Oxford, in UK. The second system went to a research center, a famous one in South Korea. And so we earned right away money and were able to reinvest it again to build GTech. This is how it is. So we just earn money, and then we can do the research that we want to do for new developments to produce new products.
Right. And how do you decide upon what next product to launch? Do you have a market research machine?
So we meet a lot of clients. So we have a lot of clients from famous universities, from research centers, from industry, the big companies which are around, hospitals, rehabilitation centers, and we hear a lot of needs what they want to have. And we have also our own rehabilitation centers in a couple of countries, for example, in Spain, in Austria, and in the US, and so on, where we treat patients. This also gives us a lot of knowledge. So I see, for example, every single stroke and multiple sclerosis patient myself and get feedback directly, and this triggers also new directions where we go. And just by coincidence, then people, for example, with incomplete spinal cord injury come in and get treated with recoverix, and suddenly we find out that also these patients get much better, which is super interesting, because in this case, the lesion is not in the brain, the lesion is in the spinal cord. And we can also produce neuroplasticity to help for incomplete spinal cord injury. And these people are also super happy if they can walk much faster.
Right. And then like the sales channel, like do you have someone in charge of sales who is actually in charge of commercializing these products?
So we have, of course, a research team and development team. So this is mostly done by PhDs that we have. So they worked for many years on a specific topic. Many of them did just a PhD with us, and afterwards they become team leaders, and also department leaders. So we have, for example, Christoph Guger, who made the PhD with GTech, and when he was finished, he took over the invasive brain-computer interface department. So whatever is neurostimulation or recording from deep structures of the brain is done by his department, and he's leading the whole team at the moment. And this is just very good. Another person is leading, for example, the recoverix team for neurorehabilitation. And in this way, we can build the products nicely. Then we're also doing the hardware production in Austria. So everything is done here in Austria. This is also nice because we have it fully under control. So the manufacturing is close by, and I can just react very quickly to customer needs. And of course, the quantity is not like a cell phone that you have to produce in Asia. Neurotechnology in the medical field and research field, and also this consumer electronic is not like a cell phone. It's not like billions of devices. So we can easily do it here. Makes more sense. Then, of course, we have a marketing team and a sales team. We have also offices in a couple of countries in Canada, for example, in the US, of course, in Colombia, in South America, and in Europe, everywhere, and also in Hong Kong and in Japan, where we have sales offices. This is also super important because different countries are focused on different applications. So this mapping system for epilepsy and tumor, for example, is very active in the US. But the neurorehabilitation, for example, is not so active in the US. It's much more active in Asia and Eastern Europe, interestingly. So most of the installed systems are in these regions because the system better supports it.
Interesting. And producing in Austria, how do you do that? It's like 3D printers, and you have pretty much all the materials that you need. There's no like complex material like the ones you would find in a cell phone. Tell me a bit more about that.
In Austria, we have very specialized companies who manufacture for the big car manufacturers like BMW, Mercedes, Audi. So electronic components are done here by PCB designers, electronic manufacturers. And this is where we get our PCBs, so the electronic devices. And then we are just doing molds for the housing. Then we make basically the end assembling, the testing, validation in-house. But the electronic components are, of course, outsourced to specialized companies. And they produce millions of these PCBs for the car manufacturers, so they don't mind if they do it also for us.
Right. Then such products, you said you have offices and hubs. How is the cell going? Is it like sending research material and proving them that the product is actually effective? How does the cell goes? Does the person actually try the product out? Tell me a bit more about that.
Very much depending on the product, of course. For the research community, they just speak with each other and they see, hey, this GTech product performs very nice. If I do EEG acquisition, brain computer interface experiments, I can do this and that. And then they just recommend it, and another lab takes it over. For the mapping system, we have, for example, very nice clients at Mayo Clinic, and they establish a very important medical protocol and get the publications and the papers and case studies out, and then other universities get interested and they just want to duplicate the same setup to be able to run the same experiments in their lab. So this is, of course, in the research space very important. For recoverix, for the neurorehabilitation, we have two strategies. So first of all, we sell recoverix just as a system to hospitals and rehabilitation centers. They already have enough patients, and then they can treat them with recoverix, which is very useful. This is mostly in the acute and subacute phase. So when somebody just had a stroke or gets ill, they are there. And then we started also a franchise system. So in this case, a businessman or a therapist, a nurse, whoever, can get all this neurotechnology into his hands, combined with training and setup. We also provide, the marketing material, the website, just everything they need. And they basically just have to find patients and they can treat them. So it's pretty easy to start such a business, especially if you already have clients. So if you're already running an occupational therapist clinic, for example, then you just need a table, you put it on, and you can use brain-computer interface technology right away. And we have already a lot of countries where recoverix as a franchise system is used. And we also like if businessmen, for example, take over a whole state or a whole country even. In Slovenia, for example, we work together with one company. They dissolve and they are rolling out recoverix in whole Slovenia. So at the end, we want to have enough recovery centers so that every stroke and multiple sclerosis patient can easily get the treatment. And they don't have to drive longer than 30 minutes to get the treatment. So this is actually our goal worldwide, so that everybody can get an ambulant treatment as quick and easy as possible.
And as the CEO, what do you focus your time and energy on a day-to-day basis?
Yeah, there are a lot of telcos nowadays with after COVID, but I try to get my teams working. So it's mostly, speaking with everybody and bring the information to everybody who needs it, so that they know exactly why they are doing something and where it should lead. And that's super important. So the information flow between team members and clients, this is basically my business.
And I believe your co-founder, Gunther, he's also the CEO. So is this like a co-CEO thing you have going?
Oh yeah, so we established GTech 25 years ago together. Everybody has 50% of the shares. And Günther is taking care of all the hardware production in Graz, in Austria. So that his team is producing all the hardware. And I'm responsible for research projects, software developments, sales, and marketing.
Very interesting. Um, Question for you in terms of Neuralink. What do you think about the project itself? Do you think it has potential? And why wouldn't GTech be involved into that race?
Uh, so what they are doing is definitely very nice and interesting and also good. They're also a client of GTech, so they purchase stuff from us, which is also nice. And they are building implants. This is something that we are not doing. So these implants are very useful for people who are paralyzed, for example, and they want to use a robotic device, for example, an exoskeleton on a daily basis, because then it should just be there and you should be able to use it whenever you want without assembling EEG electrodes before. So you need a caregiver who assembles everything for you before you can use it. This is not practical. And this is actually what Neuralink is putting into a product, which is very useful because they make it available hopefully soon, and then people can just get the implant and use it. So for these medical applications, I find it super useful. But I doubt that healthy people will want to have the implant, because at the end, with all your senses and normal communication channels, actually you're very efficient. So I doubt that an implant is needed for that. But for the medical space, it's definitely very nice. There's also Synchron, for example, from Australia. They developed a stent rod system. So it's a little bit different. In this case, you are inserting these electrodes into blood vessels, and then you don't have to make a borehole in the scalp. So it's considered to be less invasive and much easier to implant. And this is also very useful for locked-in patients, for example, to communicate. On the other hand side, there are applications where non-invasive BCI technology is just fine. So I mentioned before in the neurorehabilitation for stroke and multiple sclerosis. So these patients are coming for 25 sessions, takes altogether 18 hours. This means I have to assemble 25 times EEG electrodes. And afterwards, the brain is healthier, they can do much more, and they are released again. So an implant doesn't make any sense. I get all the information that I need from EEG technology.
What about the optimization part of it? A world in which we could communicate just by simple thoughts and understand each other's emotions by quickly understanding what's going on in this person's brain because we're Neuralink connected. How would you see that future happening? And would you even see this type of future as beneficial for humanity?
This goes a lot into neuroethics. So there are some emotions that you don't want to show. There's inner speech that you don't want to show to everybody. So some things must be private. And then there's a big discussion, of course, how much such a system should provide. There are very nice BCI projects that decoding, for example, speech. So you can just, in your mind, say a sentence, and the BCI system is able to recognize what you're saying. So this goes also into the inner speech directory. But it wouldn't be so nice if other people would see that. But we are anyhow pretty far away from that. So this is just a nice possibility, maybe for the future. People were also talking a lot about avatar control, so that you get a brain implant and you can send your personal avatar to remote places to work for you. So we are pretty far away from all these futuristic applications, but of course they trigger a lot of creativity.
Talking about the avatar stuff, like what is consciousness? Do you think consciousness can be boxed in and boxed out into another body, another being?
I don't believe that. So what we do with brain-computer interfaces is actually we are extracting commands from the human brain, but the person is doing it on purpose. So they produce these commands, and then a machine is duplicating it, what we extract. So this is pretty far away.
Yeah. Thanks for coming on today, Christoph. Where can people find out more about you?
Of course, the website GTech AT is a very good place to find something out about our brain-computer interface technology. And every year we are also running a big brain-computer interface and neurotechnology spring school. It just finished last week, and we had more than 80,000 people listening in from 118 countries. So we had 140 hours of education with many, many speakers from famous universities and research centers. And this is an annual event, so it will come next year again. So if people are interested in BCI and neurotech, this is a very good place to kickstart your knowledge.